and also the early intervention. He also was the first one, I think, to introduce the topic of personalized medicine, which I think we'll hear more about as the next decade moves forward, and we all hear about in our clinical practices. Professor Brooks then presented a very important presentation and really raised a lot more questions for us to think about as the decade moves forward. And these had to do with the workforce and how do we pay for health care in the future. I think, in the U.S. we're spending 16% of our gross domestic product on health care, and all of your countries are, not all of them, but most of them are on a path that's like this, and this is unsustainable for all of us. And we need to take advantage of looking into research as how healthcare will be delivered in the future. As part of our Healthcare Reform Act, there's pilot projects looking at different delivery systems. What kind of workforce do we actually need? He pointed out rightly so that most workforce estimates are based on the current models, but the current models won't be the models of the future. And in each of our countries, we have to develop models which are sustainable for the future. And each of us has the different parameters in which to operate to determine what models will be eventually best for us. Dr. Bunger pointed out in his presentation about advances in orthopedic management, concerns about the increasing burden of disease and trauma, the aging population, the shortage of orthopedic surgeons, the tendency to specialize as opposed to be generalized, but he emphasized what's probably the most important aspect, and that's cost effectiveness of treatment. In the United States, we're paid for the treatment, not the outcome, so that you get paid for whatever you do, not how well it turns out. And I think the paradigm is going to be changing. We have to do treatments, or we have to get evidence that provides that the treatments we're advocating are cost effective. And he pointed out, which I think is fairly obvious to all of us in orthopedic surgery, that we don't have the level 1 evidence that, for example, our colleagues in rheumatology have. We're dealing not with evidence-based practice, but expert-based practice, because the N for the different things we're treating is very small, and we don't have much resources available to do clinical trials in the orthopedic sector. We'll talk about this at some other time, but our NIAMS, which Dr. Katz is the director, has less than, he talked about the $31 billion NIH budget, but when you look at musculoskeletal conditions, that's less than 1% of the NIH budget. Way out of proportion to the burden of disease. So in orthopedics, we have a long way to go as far as elevating our level of evidence to level 1. Professor Modi really nicely illustrated the challenges of developing countries. They have very different challenges to those of us in the developed world: social challenges, high burden of communicable diseases, inadequate personnel to deal with these problems, and the fact that their burden of disease is actually higher because patients present late and they don't have the effective resources to deal with this. And you heard the figures on number of rheumatologists per population in certain countries. They also don't really have much in the way of occupational medicine going on, so the workplace is a very dangerous place in the developing world. But he also showed how international efforts to control and spread improvement of treatment of communicable diseases has resulted in the development of an infrastructure to deal with those diseases, and how in musculoskeletal systems in the developing world there is no infrastructure, and how that's a great need for the developing world. Mr. DeWitt again presented the patient perspective and the fact that we need to be developing, all of us in our practices, in our communities, in our countries, a paradigm shift to patient-centered care. This movement is about patients, and our practices as clinicians need to be patient-centered. There's a complete paradigm shift taking place now. Some of you who are familiar with the North American healthcare system know that the new Secretary of HHS, this has been one of his Health and Human Services, our health minister, sort of, if you will. This is one of been his strengths in his research efforts, is this patient-centeredness, and I think that's something that all of us as clinicians really need to know, that patient-centered care has a lot of definitions. I think the bottom line is it's a dialogue between you as a clinician or a healthcare provider and an informed and respected patient. You're helping the patient navigate through a difficult situation. They're not the experts, but you're helping them navigate these treacherous waters. And I think it was alluded to, but it's definitely proven that patient-centered care results in better patient satisfaction and better outcomes. And those of you in the medical legal climate, also lower liability risks. But it's about the patients, this movement, and patient-centered care is something this decade going forward really needs to emphasize. Judy Stenmark made a beautiful presentation about patient advocacy, and I think those of you who've been involved with advocacy and trying to change healthcare policy realize that, number one, it's expensive. Advocacy is expensive. Number two, it takes patience. It's almost like mountain climbing to Mount Everest. You know, you may not make it, but you'll get up, you'll acclimatize, you'll have to go back down, you'll try and go up again. And you just keep trying to advance the ball forward, advance the case forward. And it's only that way in which you can make policy changes. And again, I think this movement really needs to be driven by patients, because it is about patients. They are the human face to the burden of disease. But advocacy is important because if you're not at the table, you have no say and you have no chance that your issues will move forward. The challenge for the Bone and Joint Decade will be is how do I advance my issues? How do we not compete against each other? How do we collaborate together? Because we all have our own perspective. We're concerned about our disease process or our condition that our research is involved with. But our goal as a decade is really collaboration and saying we want to move everyone forward, not just our own individual priority. And that's a considerable challenge for the Bone and Joint Decade. And lastly, we heard a tremendously, I thought, exciting presentation on musculoskeletal education. Professor Brooks alluded to this earlier in his talk, but we saw tangible evidence of research on how people learn differently and how, you know, what didn't come out in the presentation is that most medical educators have no formal medical education. They're not educators, they're just doctors. Well, for example, in medical schools, they're just doctors who teach. But most doctors who teach have never had any formal educational training about teaching. And that's something I think that may need to be investigated further. But the way we educate healthcare providers in the future will definitely change, and the key for this educational change is how does it impact patients? Will it impact patient care in a positive way? But I thought this was tremendously exciting research that's to be done. So in summary, I think we've heard the themes today are moving together and moving forward, and the challenge of the decade will be for us to And I think the National Action Networks are great examples of this, of breaking down silos, because when the decade started, we came into this, I'm an orthopedic surgeon, I'm a rheumatologist, I'm a chiropractor, I'm a physical therapist, and previously we probably didn't talk to each other very much. And the patient was something we're dealing with, but not part of our team. So I think that the decade in the National Action Networks has broken down these barriers. But as you heard earlier, I think Dr. Katz mentioned it, we're the choir. And the majority of people don't hear these words, don't necessarily subscribe to the same feelings that we have. And this is one of the biggest challenges for the decade as the National Action Networks move forward. How do we move forward together? How do we look at the positive aspects of collaborative interactions between specialists, between other healthcare ancillary providers of healthcare, and most importantly, patients, because unless we collaborate together, the movement per se, I think, will not advance and realize its full potential. So it's been a great day, I think, today. I hope you've enjoyed it as much as I have, and we'll look forward to tomorrow's presentations as well.